My name is Eric Thenning, and today I will be performing a nasogastric tube irrigation on my patient. To start the procedure, I will begin by inspecting or verifying the physician's order to be sure of the kind of solution I need to use, the amount of irrigant I have to use, and the frequency of irrigation I need to do. After that, I will put my equipment together and get to the patient's room, introduce myself to him, and ask him to identify himself by telling me his name and his date of birth. I will equally confirm this by verifying his wristband. Next, I will proceed by explaining the procedure to the patient and then provide for his privacy. I will go on to sanitize my hand, put on a pair of clean gloves, and begin the procedure. To begin the procedure proper, if my patient were if he were hooked up to suction, I will stop the suction before I start the irrigation procedure. I will also assess to see if the tube is still well placed in the gastric region. I will assess by verifying that the amount of tube which is exposed is the same length that is documented in the patient's book. I will equally verify by doing an aspirate and testing the pH level of the aspirate to see that it is in the gastric region. After this assessment, I will proceed by clamping the tube and uncorking it. Then I will now instill the irrigant into the patient while making sure that it is held upright. I will insert it into the tube, unclamp it, and gently instill the 30 milliliters of irrigant into the patient. Or maybe not just 30 milliliters, the amount of irrigant that was in the physician's order. After that, I will equally pull back the entire aspirate or all what I instilled in the patient, and I might even pull a little bit more to make sure everything has been taken out of the gastric region. Then, while still leaving the syringe on, I will proceed by inserting some air into the region. I will clamp it, uncork the air vent, and instill air into the region. Having done this, I will now reconnect my patient to suction if he were on suction at the beginning of the procedure. If not, I will simply take off the syringe and cork the tube once more. Then I would clear off the mess that I would have done during the procedure, assist my patient back to a comfortable position, re-secure the nasogastric tube to his gown, take off my gloves, perform hand hygiene, measure the amount of solution or the output and then document my findings.